Hey everyone, Dr. Aaron Moreland here from Vallejo Health and Wellness Center in Eden Prairie, and today I'm going to be talking to you about haircuts. I'm just kidding. I'm not going to talk to you about haircuts, but it's April 2020 and we're in lockdown in our country right now. So to get a haircut is not an easy thing to do. And so I decided, hey, I'm just going to get my summer cut done early. And so I decided I'm going to go and get some clippers and give myself a haircut. Got to Target, got the last set of clippers, so I think a lot of other people had the exact same idea as me. Had my wife cut my hair. I think she did an awesome job. But today we're not, my video today is not to talk about haircuts, but it is to talk to you about diabetes, specifically type 2 diabetes. And the reason I want to talk to you about type 2 diabetes is this. One is that type 2 diabetes is a major health issue in our country today. Millions of people are dealing with it. Millions of people have it and don't know about it. It costs our country billions of dollars to treat it. It impacts people's quality of life in a very significant way. And unfortunately for some people, it's going to end their life prematurely because of this health issue. So that's one of the reasons I want to talk about it today. The other reason I want to talk about it today is that I want to talk to you about it in regards to coronavirus. We know that people that are dealing with certain comorbidities with coronavirus, if they get exposed to it and they get COVID-19, they're more susceptible to have a severe case of it and potentially die from it. The big ones that we've seen are hypertension or high blood pressure. Another one that we see is breathing issues like COPD and asthma. It's also diabetes, specifically type 2 diabetes, can impact someone with COVID-19 in a very significant way. But we're going to be talking about type 2 diabetes, which used to be called adult onset, but now we can't call it that anymore because we are seeing it even in kids as early as 8 years old. You're seeing type 2 diabetes, and really what the technical term for it would be that they are insulin resistance. And so I just want to go into the science just a very little bit because I want you to really understand what is going on in your body when a person is dealing with type 2 diabetes. So when we eat food, there's different macronutrients. We have proteins, we have fats, and then we have carbohydrates. And carbohydrates get turned to glucose into our body. They also, you can get fructose as well. But they get turned into sugar, okay? And so that sugar doesn't just easily get into your cells. There's a few cells that it can just go right into the cell, but most cells, it's like there's a doorway that it has to go through. And in order for it to go through that doorway, you need a hormone called insulin, which is released by your pancreas, and that insulin unlocks the door. Now glucose can get inside of your cell. And so that's the whole point of what insulin is doing in regards to glucose, okay? And so it binds to the cell wall, it unlocks the channel that allows glucose to go in, and glucose can go in. Now the problem with type 2 diabetes is that the cell becomes resistant. It becomes resistant to insulin, and there's a lot of different theories on why that is. Maybe the cell has already got too much sugar inside of it, and so it really doesn't need any more sugar inside of it, so it becomes resistant that way. And then unfortunately, as you use that sugar up, that resistance stays, and then that cell can't get sugar. Or if you've ever walked into a room and there's a smell in it, it takes a few minutes and then you become desensitized to that smell, so you don't even know it's in there anymore. So if you have too much insulin floating around all the time, what can happen is that cell becomes desensitive to that insulin, and now it becomes insulin resistant. Either way, what's happening is insulin cannot take that sugar that's in your bloodstream and shuttle it into the cell. It can't unlock that door. And so that's what insulin resistance is, or type 2 diabetes is, okay? And so what we want to talk about is can this be fixed then, okay? Because a lot of us would say that, well, this is a chronic health issue. You can't really fix it once you have diabetes. There's no coming back. And that's just not true. We see it time and time again that people are able to reverse diabetes. So it's really important that you can learn how to do that. And so one of the things that we have to look at first and foremost is that it's really not a sugar problem. This is what most people look at. They go get their blood sugar checked, the blood sugar is high, so they see it as a sugar problem when really it's an insulin and an insulin receptor problem. And so the goal in trying to reverse insulin is, or type 2 diabetes or insulin resistant diabetes, is not so much to focus on your blood sugar, because you really don't want to just force your blood sugar down, because those cells are still going to be insulin resistant. What you want to do is reduce the insulin, not the sugar. And so the sugar is more of a symptom, okay? And so we want to take care of that by actually dealing with the insulin. So what you see with a lot of times with type 2 diabetes is that you'll see that they will actually give that person insulin. And so the problem with that is, if you look at the real problem with type 2 diabetes, it's that you have too much insulin. Giving someone too much insulin, giving them insulin doesn't make a lot of sense. It's kind of like taking an approach to an alcoholic. Well, we're taking away their alcohol, but they're getting shaky, they're getting tremors, they're going through withdrawal. So let's just give them alcohol during this time to solve the problem. Well, that wouldn't fix the problem. You wouldn't give alcohol to an alcoholic. You really shouldn't be giving insulin to someone that already has too much insulin. So again, we want to focus on the receptors. We want to focus on how can we make it so that that insulin is now sensitive to the receptors, so that that receptor can allow that sugar into the cell, okay? And the cool thing is, and people, I'm not going to go into great detail about this, but a lot of people don't realize that insulin is used in many other things, unlocking gates to many other things besides just getting blood sugar into your cells. So by making a person insulin sensitive, it can help with a lot of other things, including brain health issues, okay? And so we want to see how we can, I want to talk to you for the rest of this video, how you can make your cells insulin sensitive, okay? Because if you're worried about this COVID-19, it's really important that you are not dealing with this insulin resistance, because as we know from statistics, those people are more apt to have a very severe case of COVID-19, and unfortunately some people will die because they have diabetes. So the first thing we want to look at is testing. How do you even know? Because I think a lot of people, the studies show that there's millions of people in America right now that are walking around that don't even know that they have type 2 diabetes. So if you're hearing people saying, well, there's this healthy person got COVID-19 and they died, well, we don't know if they had an underlying health issue, and a lot of people don't know that they have the two big ones: hypertension, high blood pressure. So a lot of people don't know that they have that because you can't feel it, and a lot of people don't know that they have diabetes or that they're pre-diabetic. So a lot of times we go to the doctor, they test your blood sugar, and so you can test your own blood sugar through a glucometer, but they will look at a 12-hour fasting blood sugar. But the problem with that is that your blood sugar could be normal, but yet you're working really hard to get it normal. So I always use the analogy, if I have an 8-cylinder car and I'm driving down the road but only 4 cylinders are working, I may not know it necessarily. I might notice that, hey, my car's kind of sluggish and such. But can you imagine if I took it to a mechanic and he just said, well, if we can get it up to 60 miles an hour, then that means that there's no problem with your car. That would be ridiculous. But that's really what they're doing when they're looking at your blood sugar. So if you are releasing tons and tons of insulin to get your blood sugar down to normal, you could go in and get a blood test, your blood sugar would look normal, but the problem is you're using 2 times, 3 times, 10 times the amount of insulin to get your blood sugar to that level. So we have to look at beyond just looking at someone's blood sugar. So then another test that they'll do, and it is a great test, is hemoglobin A1C, which is looking at, well, how has your blood sugar been on average over the course of the last 3 months? But again, if you've got this insulin, this huge amount of insulin being pumped into your system, and it's keeping your blood sugar normal, that hemoglobin A1C will even look normal. So there's actually a couple tests that you can do that can actually look at your insulin. Because again, remember, type 2 diabetes is an insulin problem. It's not a blood sugar problem. So if it's an insulin problem, wouldn't it make sense to measure someone's either their insulin or this marker right here, C-peptide. So you can measure someone's insulin in their blood. There is a test for that. Now I used to think it must be a really expensive test. That's why doctors don't run these tests. But I know from ordering this test that this test here is like $20-some. That's it. And a C-peptide test is like $60-some. So it really is not an expensive test. I've sent patients in that have had borderline high blood sugar and had them get their C-peptide tests done. And definitely they saw that their insulin levels were high to the point where they were way above normal, so they were pre-diabetic just based off of looking at their C-peptide or their insulin levels. You don't want to wait until your blood sugar is up too high. The numbers when we look at blood sugar, some people would say 70 to 100. That's the normal range. We use pretty tight range, 85 to 100. But once you start creeping over that 100, you've got high blood sugar, and you probably have very high insulin, unless of course you're dealing with more like a type 1 diabetes. And again, I'm not going to get into detail about that. So what we order is C-peptide, and we look at insulin. So how do we solve this problem? Let's say it is high. How do we get this down then? One of the first things you need to do is you need to look at cutting down on sugars. Okay? Now, if you look at this picture, you'll see that there's a lot of good healthy things in here. There's things though that maybe aren't so healthy, like maybe the bread and such. But when most people think of sugar, what they think of is candy and cookies and like pixie sticks and things like that, which definitely are bad things. So you want to cut those things out of your diet right away. Those are the things that you shouldn't be eating, very rarely if you're going to eat them. But if you're pre-diabetic or diabetic, you just got to stop eating that stuff. And I know that that can be hard, but if it's the thing that's going to potentially cause you to die, that it's something you really have to look at changing that. And I'll talk about some of the ways that you can actually do that, some things that you can do that will be very helpful, that will help you to be able to overcome those sugar cravings. But then we look at things like fruits, especially more like the higher sugar fruits. When we think of watermelon and even strawberries, some of these high sugar fruits, they can really impact your insulin levels. So if you've ever heard of people talking about a high glycemic index food, what that means is when you eat that food and then you measure someone's blood sugar about an hour afterwards or even less, you can see that it really spikes someone's blood sugar. And the problem with that is when you spike someone's blood sugar like that, your insulin has to match that so we can get that blood sugar down. So now you get this insulin spike, and that can create that insulin resistance that we talked about. Now, if you go online, you'll see that there's all kinds of charts out there. The high glycemic foods, it'll list off those high glycemic index foods, but then you'll see low glycemic index foods, and they'll say those are the foods you should eat to avoid eating too much sugar. The problem with that is each person processes sugar different. And so they did a study, and if you want to watch a great video, it's a TED Talk. It's called The Perfect Human Diet. And the gentleman that does the talk, he goes into details about the study that they did where they looked at people, each person individually, to see how a specific food impacted their blood sugar. And it was interesting because if you ask most people, if you ask them, well, is white rice a higher glycemic index food than brown rice? It absolutely is, according to the studies that they've done. But in this study, in each individual, it was different. Some people would eat white rice and have very low blood sugar afterwards. And if they ate brown rice, it would spike their blood sugar, which is the exact opposite of what you'd think. And so what you have to do is you have to learn to really pay attention to how your body responds to food. So even fruit can be an issue. Even some of the vegetables that we eat can be an issue with raising someone's blood sugar. And so you really have to play around with it. But know this, cutting sugar out of your diet is one of the first places that you need to start helping somebody reverse diabetes. And so there's lots of different diets out there. Some of the diets that are big right now, the ketogenic diet, which is a higher fat diet, and you're eating very low carbs. So of course, if you think about it, if you're eating very low carbs, it is going to reduce your blood sugar. The problem is eating high fat and high protein, though, can also sometimes raise people's insulin depending on the person, so they may not see that insulin decrease, but they definitely see that their blood sugar goes down. Paleo diet, another diet that really cuts out carbohydrates. The Atkins diet, if you remember that, that really cut out carbohydrates, but the problem was, and as you see this with the keto, the paleo, and the Atkins, is a lot of people think, well, I'll just eat bacon, I'll eat poor, unhealthy meats, and I'll lose weight, and a lot of people do, but the problem is it doesn't change their metabolic health issues, and they really don't get any healthier. And so there's these diets, the Mediterranean diet. Again, what you're doing with the Mediterranean diet is you're cutting out so many of those processed carbohydrates, the highly refined carbohydrates, which turn to sugar really quickly, and you're replacing it with good vegetables, good healthy fats. And so it's really helpful because it helps to get rid of the sugar out of your diet. So that's why these diets are so helpful. So really, what you have to do is play around with these diets and see which one would be right for you. And one of the things that you can do is I'd highly recommend that you purchase your own glucometer, and you can take your blood sugar before you eat, and then you can take it an hour, 2 hours, and you would be taking it with a finger prick, and so just understand that. But it really can show you how you're processing sugar when you're eating that. So cutting the sugar out of your diet, using a glucometer, switching to a diet more like a paleo, keto, Mediterranean. These are all things that you're going to have to play with individually, or a modified, some people would call it a modified keto, where you're not eating that 80 to 85% of your calories from fat, but you're more in that 30, 40, even 50% of your calories coming from fat. So you really have to play with all these different types of diets, but cutting the sugar out can make a huge difference. The other thing that can be super helpful is intermittent fasting. I'm not going to go into great detail. I'll tell you there's some great videos out there. Mike Mutzel from High Intensity Health has some great videos on fasting. Thomas DeLore also has some great videos on fasting. Dr. Axe. So these guys have videos that I'd highly recommend watching, because fasting can be super helpful. And the reason why, one, is if you're not eating, you're obviously not getting any carbohydrates, and you're eliminating sugar completely out of your diet, because you really don't have a diet while you're fasting. And then what your body does is it taps into that sugar, and then that can make it more, those insulin receptors more sensitive, because now you've tapped into that sugar, you've tapped into those store fats that you'll see in people that are dealing with fatty liver or that omentum fat. And so it'll tap into that fat for energy, and then the benefit to that will be that now those insulin receptors will become more sensitive, because they'll want more to allow more fat and sugar into the cells. So fasting can be really helpful. Lots of different ways. Like I said, there's great videos to watch about on it, but you can do a 1-day fast or 1 meal a day fast. You can do an 8-hour window fast. You can do like a 3-day fast. What you're going to have to do again is you're going to have to play with it. But the key, and I cannot stress this enough, if you're dealing with diabetes, you cannot do this on your own. You really want a health practitioner to come alongside you, because this will be a struggle for you because you have such poor management of your blood sugar. And so it's really important that you are working with a health provider if you are going to be trying to reverse diabetes, and fasting is definitely one that you want to work with a practitioner. Another one is exercise. Exercise, we know that exercise increases insulin receptor sensitivity, especially in your muscles. Your muscles put out a demand for glucose, and so if you're exercising, you're going to put out a demand that's going to make those cells insulin sensitive. Aside from exercise, there's a few other things that you can do to intervene to help you to reverse type 2 diabetes. One of them is a thing called short-chain fatty acids. Short-chain fatty acids come from when we eat food that's high in fiber. We can't digest that fiber, but the bacteria in our gut can. And the great thing about it is when it does eat that fiber, it produces short-chain fatty acids. And what those short-chain fatty acids do is they can actually work as fuel for the lining of our intestines, and so that's one of the benefits of short-chain fatty acids. The other benefit is a short-chain fatty acid will get into the bloodstream and it'll impact a thing called a T regulatory cell, and that actually plays a huge part in your immune system. And by impacting that T-reg cell, what it does is it reduces inflammation, and by reducing inflammation you can actually help your body work, utilize that insulin better, because insulin does not do well when the body is inflamed. And so the short-chain fatty acids can make a huge impact on our immune system, which indirectly makes an impact on our insulin levels. So we can take it, we can get short-chain fatty acids by eating food that's high in fiber, like our vegetables and our fruits, but we can also get it from taking it as a supplement, which can be a very beneficial way, and you can take it at high amounts so you don't have to deal with the amount of fiber that you would need to eat to get the short-chain fatty acids. So that's one of the ways. Another way is through a supplement called Berberine. So this berry here, it actually can make a huge impact on whether your cell is sensitive to the insulin that's being put out. And so Berberine was actually, they just did a study not too long ago that showed that it was as effective as Metformin, which is a drug that's being prescribed for people that are dealing with type 2 diabetes. So Berberine can be very helpful. Another thing that a lot of times people have when they're dealing with diabetes is they do have cravings for sugar. That's one of the reasons why they might have developed type 2 diabetes in the first place. So there's a supplement or a plant that you can chew on or take as a supplement called gymnema. And gymnema, what it does is it curbs that craving for sugar. And so if you're eating supper and you got to have something sweet afterwards, you got to have something sweet in between meals, this gymnema can be really impactful. One of the companies that we work with is called Apex Energetics. And Apex Energetics has got a great track record of helping people dealing with chronic health conditions. And in our office, we deal with a lot of people that have chronic health conditions. And so Apex has been a supplement company that we work with because of that. And when it comes to type 2 diabetes, they have a supplement called Glycin Synergy that is really helpful because it has things like berberine in it, it has short-chain fatty acids in it, it has things like gymnema in it, it has many different things that can help somebody that's dealing with type 2 diabetes to reverse type 2 diabetes. So this is a great supplement. Now with these different supplements, with these different products, I would highly recommend that you'd want to be working with a healthcare practitioner that understands type 2 diabetes, knows how to utilize these supplements, knows how to do proper testing, because it's not an easy path to take. And so Glycin Synergy can be a great supplement to take. And then finally I want to talk to you about Metformin. Now in our office we don't prescribe. I'm a doctor of chiropractic, so we're not prescribing doctors. So Metformin is a medication. Now some people with type 2 diabetes, it's so far along that they're going to need help. They're going to need an intervention like a medication, or maybe they've got prediabetes that they've had for many years, and doing it with just the supplements and stuff may not be enough, that they need to have a medication. So when we work with someone with type 2 diabetes, we recognize that that's a possibility, and we will refer to doctors that can prescribe, doctors that we know that we work with that understand type 2 diabetes, so that they can get the help that they need, so that they can finally get through this. Another great resource would be this book called The Diabetes Code. Dr. Jason Fung, he also wrote a book called The Obesity Code. These two books, he's got great videos, interviews on YouTube. These are a great resource because he does teach you about type 2 diabetes, what it is, how to reverse it, what kind of interventions you can do. So I'd highly recommend, if you do have type 2 diabetes, you're pre-diabetic, or you just don't want to go down that path of poor blood sugar control, highly recommend reading or watching Dr. Jason Fung's videos. What I want to leave you with today is that there is hope. I want you to understand this, that type 2 diabetes, while it is a chronic health condition, it can be helped. There are things that you can do to help this. There are things that you can do to reverse it, and understand that it's not, we work with this all the time. We know that this is not an easy thing to do, okay? So can you reverse it? Yes. Is it easy to do? I would say no, because of there's a lot of lifestyle issues. And so we have a health coach in our office that can come alongside someone who's trying to make these changes, trying to help that person, because it can be frustrating. You can be working on intervening, you can be doing a lot of these things I just talked about and still not losing the weight because the insulin's not coming down. And if the insulin does not come down, I want you to understand that if you have high insulin, you cannot lose weight. And that's one of the big things that people are hoping to see as they go through this, is they want to lose weight. And with high insulin, you can't do that. So you need to do things that would help reduce that insulin. There can be other hormone issues that are a problem. So working with a practitioner that understands this is critical in order to be successful through this. But understand this, we are here to help you. We understand it. We understand that it can be frustrating, but there is hope, that there is something that you can do about it. And it can be done, and you can notice changes in the next few weeks to few months by taking these interventions, by taking these steps. So again, my name is Dr. Aaron Moreland. We're here to help you through this. We're here to help you to do the right things for your body, to get your body working the way that God designed your body to work. And so if you like the video, just hit thumbs up. If you want to see more videos, just subscribe to our channel. Then you'll know that we've got other videos coming out, because we're always putting out videos to help you to be as healthy as you possibly can. Hopefully you're having a great day. We'll see you in the next video. God bless.